So, post inflammatory hyperpigmentation, or PIH, is unfortunately relatively common after surgery and injuries. Luckily, though, we have a lot of treatments for this, and they're typically quite effective. So, if you're a patient who had an injury or scarring and the area became darker or hyperpigmented, the first thing to try is always topical agents. Now, there's lots of options out there. The most common things are going to have an active ingredient called TXA or an active ingredient called hydroquinone. Your physician will talk to you about which one is best and how to use those, but they are quite effective. They do take some time, though. It's not going to fade it in 24 hours. They can take several months to work, but they do work pretty well. The next thing that we sometimes consider is adding some kind of treatment. So, either a laser or microneedling in addition to a topical agent can be very effective. And then finally, that topical agent I mentioned, TXA, there's an oral version of it. So for patients that have very stubborn pigmentation, the oral version can be helpful, and we do use that occasionally as well. And then finally, make sure that if you are someone who has a tendency towards getting PIH or you already have it, be really careful with your sun exposure because sun exposure can make things significantly worse. So that's just a quick little explanation of typical treatments for PIH when it comes to scars or traumatic injuries to your skin. Let me know if you have any more questions.